snoring increases your heart risk. Loud snoring may be associated with obstructive sleep apnea. So obstructive sleep apnea usually associated with high BP levels and increased risk of cardiac events. So this sleep apnea will cause breathing interruptions during your sleep. It is also associated with heart rate and heart rhythm abnormalities and stroke risk. You can see the common symptoms like daytime sleepiness and fatigue during the working hours. So early diagnosis and treatment of this obstructive sleep apnea can decrease your blood pressure risk and also indirectly decreases your heart attack and stroke risk.